As people age, the brain becomes more sensitive to medications that were once well tolerated. Many seniors and caregivers are unaware that some commonly prescribed and over-the-counter drugs can impair memory, slow thinking, and even accelerate dementia-like symptoms. In fact, medication-related cognitive decline is one of the most overlooked and preventable causes of sudden confusion and memory loss in older adults. What makes this issue especially concerning is that these medications are often taken daily, long-term, and in combination, increasing their impact on the aging brain. Some affect vital neurotransmitters needed for memory, while others sedate the brain or interfere with normal brain signaling. Over time, this can lead to forgetfulness, disorientation, personality changes, and a rapid decline in mental clarity, symptoms that are frequently mistaken for normal aging or irreversible dementia. It's important to understand that these medications do not always cause dementia on their own. However, in vulnerable seniors, they can trigger or worsen cognitive decline, especially when used without regular review. The encouraging news is that in many cases, medication-induced cognitive problems may be partially or fully reversible when identified early. This guide highlights 9 popular medication categories that seniors and caregivers should approach with caution. Awareness is the first step toward protecting brain health. Asking the right questions, and ensuring that treatment improves quality of life without silently harming the mind. Number 1, anticholinergic medications are among the most dangerous yet commonly used drugs for seniors, and they are strongly linked to memory loss and accelerated cognitive decline. These medications work by blocking acetylcholine, a vital neurotransmitter responsible for memory, learning, attention, and clear thinking. Unfortunately, acetylcholine levels naturally decline with age, and in conditions like Alzheimer's disease, they are already critically low. When seniors take anticholinergic drugs, the brain's remaining supply is further suppressed, creating a perfect storm for confusion and dementia-like symptoms. What makes anticholinergic medications especially risky is that many are over-the-counter or prescribed for everyday problems, such as allergies, insomnia, bladder control, motion sickness, and depression. Common examples include sleep aids containing diphenhydramine, bladder medications like oxybutynin, and older antidepressants, such as amitriptyline, and some drugs used for Parkinson's disease. Because these medications are often taken daily and for long periods, the cognitive damage can accumulate silently over time. Studies have shown that long-term use of anticholinergic drugs in older adults is associated with a significantly increased risk of dementia, with some research indicating up to a 40 to 50% higher risk after several years of regular use. Seniors may first notice subtle warning signs such as forgetfulness, difficulty concentrating, slowed thinking, or sudden confusion. These symptoms are frequently mistaken for normal aging, allowing the problem to worsen unnoticed. The good news is that medication-related cognitive decline can sometimes be partially or fully reversible if caught early. Seniors should never stop these medications abruptly, but they should urgently review them with a doctor or pharmacist. In many cases, safer alternatives with lower anticholinergic burden are available, making this one of the most preventable causes of memory decline. Number 2, older antidepressants, particularly tricyclic antidepressants, TCAs, have long been used to treat depression, chronic pain, migraines, and sleep problems. While they were effective in their time, these medications can be especially harmful to the aging brain. As seniors grow older, their bodies process drugs more slowly, allowing these medications to remain in the system longer and exert stronger effects on the brain. This greatly increases the risk of cognitive side effects. The biggest concern with older antidepressants is their strong anticholinergic activity. Like other anticholinergic drugs, they block acetylcholine, the neurotransmitter essential for memory, learning, and focus. When acetylcholine is suppressed, seniors may experience brain fog, forgetfulness, slowed thinking, and confusion. Over time, this cognitive burden can resemble or accelerate dementia, particularly in individuals already at risk. Common examples of older antidepressants include amitriptyline, imipramine, and nortriptyline. These drugs are still prescribed today, sometimes for nerve pain or insomnia rather than depression, which means many seniors may not realize they are taking a medication that affects memory. Side effects often appear gradually, making it difficult to link cognitive changes to the drug itself. Research has shown that long-term use of these antidepressants in older adults is associated with an increased risk of cognitive decline and dementia, especially when combined with other anticholinergic or sedating medications. Seniors taking multiple prescriptions are at even greater risk due to cumulative brain effects. Fortunately, safer alternatives exist. Many newer antidepressants have little to no anticholinergic effect and are generally better tolerated by older adults. Seniors experiencing memory problems, excessive drowsiness, or mental slowing should speak with their doctor about reviewing their medications. Adjusting or switching drugs under medical. Number 3, antipsychotic medications are powerful drugs originally designed to treat serious psychiatric conditions such as schizophrenia and bipolar disorder. However, in seniors, these medications are often prescribed for agitation, hallucinations, sleep disturbances, or behavioral symptoms, sometimes even in people with early dementia. While they may temporarily calm behavior, antipsychotics can have serious and lasting effects on the aging brain. One of the greatest dangers of antipsychotic medications in older adults is their impact on thinking, memory, and overall cognitive function. These drugs alter dopamine and other neurotransmitters that are critical for attention, motivation, and mental processing. In seniors, this disruption can lead to mental slowing, confusion, emotional flattening, and worsening memory. In many cases, family members notice a sudden personality change or a rapid decline in mental sharpness after the medication is started. Commonly prescribed antipsychotics include risperidone, olanzapine, quetiapine, and haloperidol. Studies have shown that in older adults, especially those with dementia, antipsychotics are associated with a higher risk of stroke, accelerated cognitive decline, and increased mortality. For this reason, most medical guidelines recommend using these drugs only as a last resort and for the shortest time possible. Another serious concern is that antipsychotics can cause drug-induced Parkinsonism, leading to tremors, stiffness, slowed movement, and further cognitive impairment. These symptoms may be mistaken for natural aging or disease progression, delaying proper intervention. While antipsychotics can be life-saving in certain situations, they should never be used casually in seniors. Any older adult taking these medications should be closely monitored, and caregivers should regularly ask whether the benefits still outweigh the risks. In some cases, reducing the dose. Number 4, benzodiazepines are commonly prescribed to seniors for anxiety, insomnia, panic attacks, muscle spasms, and restlessness. While these medications can provide fast relief, they also act as powerful central nervous system depressants, which makes them particularly dangerous for the aging brain. As people age, the brain becomes more sensitive to these drugs, and even standard doses can cause significant cognitive impairment. Benzodiazepines work by enhancing the effects of GABA, a calming neurotransmitter that slows brain activity. In seniors, this slowing effect often goes too far, leading to memory problems, reduced attention, confusion, and slowed thinking. Many older adults experience difficulty forming new memories while on these medications, which can feel frightening and may be mistaken for early dementia. Common benzodiazepines include diazepam, Valium, alprazolam, Xanax, lorazepam, Ativan, and clonazepam. Research has consistently shown that long-term or regular use of these drugs in older adults is associated with a higher risk of cognitive decline and dementia, especially when taken for months or years. The risk increases further when benzodiazepines are combined with alcohol, opioids, or other sedating medications. Another major concern is dependence. The brain quickly adapts to benzodiazepines, making them difficult to stop. Withdrawal can trigger severe anxiety, confusion, insomnia, and even delirium, which can dramatically worsen cognitive symptoms. Because of this, seniors may remain on these drugs far longer than intended. Medical guidelines now recommend avoiding long-term benzodiazepine use in older adults whenever possible. Safer alternatives for anxiety and sleep often exist, including non-drug therapies and newer medications. Seniors experiencing increasing forgetfulness, daytime drowsiness, or mental fog should have their medications reviewed, as reducing or carefully tapering benzodiazepines under medical supervision can significantly. Number 5, bladder antimuscarinic medications are commonly prescribed to seniors for overactive bladder, urinary urgency, and incontinence. While these drugs can reduce frequent bathroom trips, they're among the strongest contributors to medication-related memory loss in older adults. Many seniors take them daily for years without realizing the serious impact they can have on brain health. These medications work by blocking muscarinic receptors to relax the bladder. Unfortunately, the same receptors are essential for memory, attention, and learning in the brain. Most bladder antimuscarinics readily cross the blood-brain barrier, where they suppress acetylcholine, the key neurotransmitter already reduced in aging and Alzheimer's disease. The result can be confusion, forgetfulness, slowed thinking, and dementia-like symptoms. Common bladder antimuscarinic agents include oxybutynin, tolterodine, solifenacin, darafenacin, and fesoterodine. Among these, oxybutynin is particularly concerning due to its strong anticholinergic effects. Studies consistently show that long-term use of these drugs in seniors is associated with a significantly higher risk of cognitive decline and dementia, even after adjusting for other health conditions. What makes this risk especially dangerous is that bladder problems are chronic, meaning these medications are often taken continuously rather than short-term. Cognitive changes may develop slowly, making it easy to overlook the connection between the drug and declining memory. Many seniors are then misdiagnosed with irreversible dementia when the medication may be a major contributing factor. The good news is that safer alternatives exist. Newer bladder treatments, lifestyle changes, pelvic floor therapy, and non-anticholinergic medications may help control symptoms without harming the brain. Seniors experiencing memory problems while taking bladder medications should request a full medication review. In many cases, adjusting or switching therapy. Number 6, antiepileptic medications, also known as seizure drugs, are prescribed not only for epilepsy, but also for nerve pain, migraines, mood stabilization, and sleep disorders. While these medications are essential for many patients, some older antiepileptics can significantly impair brain function in seniors, especially when used long-term. Aging brains process these drugs more slowly, increasing their cognitive side effects. Many older antiepileptics work by suppressing electrical activity in the brain to prevent seizures. In seniors, this suppression can go too far, leading to mental slowing, poor concentration, memory impairment, and reduced alertness. Over time, these effects can resemble or accelerate dementia, particularly in individuals already vulnerable to cognitive decline. At higher risk, antiepileptic medications for older adults include phenytoin, phenobarbital, and, in some cases, carbamazepine. These drugs have been associated with problems such as confusion, impaired learning, and decreased processing speed. Phenobarbital, in particular, has strong sedative properties that can cause persistent brain fog and daytime drowsiness in seniors. Another concern is polypharmacy. Seniors taking antiepileptics are often prescribed additional medications, such as antidepressants or painkillers, which can compound cognitive side effects. Drug interactions may further increase confusion and memory problems, making it difficult to identify the true cause of decline. Research suggests that long-term use of certain antiepileptics may be associated with an increased risk of cognitive decline and dementia-like symptoms in older adults. While these medications are sometimes unavoidable, careful dose adjustment and regular cognitive monitoring are essential. Fortunately, newer antiepileptic drugs tend to be more brain-friendly and better tolerated by seniors. Older adults experiencing memory loss, confusion, or mental slowing while on seizure medications should speak with their. Number 7, certain antihistamines are widely used by seniors to relieve allergies, cold symptoms, nausea, and insomnia, yet they are among the most overlooked causes of medication-related memory problems in older adults. Many of these drugs are easily available over the counter, leading people to assume they're completely safe for long-term use. In reality, some antihistamines can significantly impair brain function in seniors. The biggest concern involves first-generation antihistamines, which have strong anticholinergic effects. These medications block acetylcholine, a neurotransmitter that plays a vital role in memory, learning, and concentration. Because acetylcholine levels naturally decline with age, suppressing them further can trigger confusion, forgetfulness, and slowed thinking. In some seniors, this cognitive impairment can appear suddenly and resemble early dementia. Common high-risk antihistamines include diphenhydramine, found in Benadryl and many nighttime sleep aids, chlorpheniramine, and promethazine. Diphenhydramine is especially problematic because it is frequently used as a sleep aid, meaning seniors may take it night after night for months or years. This repeated exposure can quietly accelerate cognitive decline. Another hidden danger is that antihistamines can cause daytime drowsiness, poor balance, and increased fall risk, which further threatens independence and brain health. When combined with other sedating medications, such as benzodiazepines or painkillers, the cognitive effects become even more severe. Medical experts strongly advise seniors to avoid first-generation antihistamines whenever possible. Newer, second-generation antihistamines are generally less likely to cross the blood-brain barrier and may be safer alternatives. Seniors experiencing brain fog, confusion, or memory changes should review all over-the-counter medications with a healthcare professional, as stopping or switching these drugs under medical guidance may lead. Number 8, corticosteroids are powerful anti-inflammatory medications commonly prescribed to seniors for arthritis, asthma, autoimmune diseases, allergies, and chronic pain. While these drugs can be life-saving and highly effective, long-term or high-dose corticosteroid use can have serious effects on brain health, especially in older adults. Corticosteroids, such as prednisone, prednisolone, and dexamethasone influence how the brain regulates mood, memory, and stress. In seniors, these medications can disrupt normal brain signaling, leading to confusion, memory problems, mood swings, anxiety, and even hallucinations. Some older adults develop a condition known as steroid-induced cognitive impairment, which can closely mimic dementia and may be mistaken for permanent brain decline. One of the most concerning effects of corticosteroids is their impact on the hippocampus, the brain region responsible for learning and memory. Prolonged exposure to high steroid levels can impair this area, resulting in difficulty forming new memories and slowed mental processing. These changes are often subtle at first, but may worsen with continued use. Another risk is that corticosteroids can disturb sleep patterns, increase blood sugar, and elevate blood pressure, all of which indirectly harm brain health. Seniors are particularly vulnerable because their bodies metabolize steroids more slowly, allowing cognitive side effects to accumulate. The encouraging news is that steroid-related cognitive symptoms are often partially or fully reversible when the dose is reduced or the medication is discontinued under medical supervision. Seniors taking corticosteroids who notice confusion, personality changes, or memory loss should promptly discuss these symptoms with their doctor to explore safer dosing strategies or alternative treatments. Number 9, opioids and other sedating pain medications are frequently prescribed to seniors for chronic pain, arthritis, post-surgical recovery, and severe injuries. While pain control is important for quality of life, these medications can pose serious risks to brain health when used regularly or long-term in older adults. Aging brains are far more sensitive to drugs that suppress the central nervous system, making cognitive side effects more pronounced. Opioids work by binding to receptors in the brain and spinal cord to block pain signals. However, they also slow overall brain activity, reducing alertness, attention, and memory formation. Seniors taking opioids may experience brain fog, confusion, poor concentration, and difficulty processing information. Over time, these effects can resemble or accelerate dementia, particularly in individuals already at risk for cognitive decline. Common opioids include morphine, oxycodone, hydrocodone, codeine, and tramadol. Tramadol deserves special caution because it also affects brain chemicals involved in mood and cognition, increasing the risk of confusion and hallucinations in older adults. The danger becomes even greater when opioids are combined with other sedating medications such as benzodiazepines, sleep aids, or certain antidepressants, a combination that could dramatically worsen memory impairment and raise the risk of delirium. Another major concern is that opioids can reduce oxygen delivery to the brain, especially during sleep, and disrupt normal sleep cycles that are critical for memory consolidation. They also increase fall risk, which can lead to head injuries and further cognitive decline. While opioids may be necessary for short-term or severe pain, long-term use in seniors should be carefully monitored. Safer pain management strategies, lower doses, or non-opioid alternatives may be available. Seniors experiencing increasing confusion or memory problems while on pain medications should seek a medication review.